Metastasis is usually the thing that causes death in cancer patient, and we will get into why that is and how it happens. Understand the lethality of metastasis and describe the TNM system for cancer staging. Identify the major steps of metastasis process. Explain the principle of metastasis homing and the seed and soil hypothesis. By definition, metastasis can be broken down into two parts. Meta meaning to alter something or something beyond, and stasis meaning a state of inactivity or stagnation, or put together. Metastasis is, if we put them together, metastasis meaning is changing or moving beyond something stationary. In clinical terms, we use metastasis to refer to the process which tumor cells go from a primary tumor such as prostate tumor to a different organ such as bone. Prostate cancer growing in the prostate is an example of primary tumor, whereas prostate cancer cells that have gone to the bone and begun growing there is an example of metastatic prostate tumor. In other words, if someone has cancer cell growing in their bone, they may not necessarily have bone cancer. It only matters where those cancer cells originated. If they originally grew in the prostate, for example, then that cancer would be referred to as prostate cancer, even though it's in the bone. Some terms to know that I will be using. Metastasize is the actual act of cell going from a primary tumor to a secondary site. Metastatic is an adjective describing a cancer that metastasizes. Metastases refer to multiple metastatic tumors, so let's focus on primary tumor first. We are heard of the words benign and malignant in reference to cancer. The very definition of malignant tumor is a tumor that has tumor cells that have the ability to invade neighboring tissue and metastasize. A benign tumor may grow to a certain extent, but as long as they don't develop the ability to metastasize, they remain benign. Genome instability and an altered metabolism cause cells to become more aggressive and mobile. The ability of cells to resist cell death and avoid immune destruction allows for them to survive harsh conditions in the metastatic journey, and tumor-promoting inflammation promotes metastasis by bringing certain immune cells to the primary tumor that actually engage with tumor cells and cause them to leave the primary site and enter circulation. And angiogenesis, the formation of blood vessels, provides a way for tumor cells to leave the primary site and enter the bloodstream. Word metastasis was used to first describe metastatic tumor in breast cancer patients who were lactating. They called it metastasis of milk. Associated metastasis with cancer diagnosis and treatment was first done in 1829, and the process of tumor dissemination later in 1858. Since then, cancer researchers have discovered much about the process and the nature of metastasis. We know that all solid tumor can metastasize. Liquid cancer like leukemia don't metastasize because there is no primary tumor, and most people who die of cancer will die because they have a metastatic tumor. Some cancers are diagnosed infrequently with metastatic cancer, such as breast and prostate, likely due to better screening method which can find tumor before they become metastatic. Some tumors, however, are difficult to screen and detect and therefore become metastatic by the time they are diagnosed. You can see the tumor of deaths worldwide, the number of deaths worldwide due to 6 most common cancer: breast cancer, prostate, lung, colon, liver, and stomach. Metastatic cancer is still a huge problem worldwide. In addition, this shows that in general the metastatic disease is the real killer of cancer patients. Non-metastatic cancer are much less lethal in general. A 5-year survival rate refers to the percentage of patients that are still alive 5 years after diagnosis. So, for non-metastatic prostate cancer, 70% of patients are alive 5 years after diagnosis. For metastatic prostate cancer, only 29% of patients are still alive after 5 years. A similar dramatic difference can be seen in each of the other 6 cancers. So now we know that metastasis is the biggest killer in cancer. How does cancer actually kill people? Only way is through the loss of tissue function due to tumor growing in an organ and damaging or blocking its natural function. An example of this is metastatic tumor growing in the brain and causing loss of regular brain function. Excessive bleeding can cause irreversible problem for cancer that can lead to death. An embolism is a blockage of an artery and it's happen in the lung. You likely have a pulmonary embolism. Cancer patients are also more prone to infection, partially due to the cancer affect the immune system and partially due to the effect of chemotherapy on the immune system. Speaking of cancer treatment, chemotherapy and radiation can cause irreparable damage to various organ systems. This includes treatment that manage pain with metastatic cancer patients tend to feel a lot of cachexia is a term that generally means weakness and wasting away due to severe chronic illness, and cancer is centrally that. Metastatic cancer can also disrupt ion balance throughout the body, and the bone metastasis in particular cause severe hypercalcemia, which is excessive amount of calcium in blood stream, which can be fatal in severe cases.